See, varicose veins are dilated veins which you can find in mostly lower limbs, means in the legs. They are dilated, they are engorged, and they are elongated. So that is because of reflux of blood. So what happens normally, the blood flows towards the heart, and when the blood flows towards the heart, there are one-way valves. So when blood flows in the reverse direction, it means the blood has to flow against gravity, because of the valves. So when these valves get damaged, or because of some reason the blood does not flow towards the heart, it comes gravity wise, so it comes down, and that causes engorgement of these veins. See, spider veins are veins which are less than 3 mm in size. Lot of ladies, lot of people take treatment for spider veins for cosmetic reasons. It means that they want to wear small skirts or half pant, and there are a lot of small veins which are there in their legs, and it looks cosmetically bad, and that is why treatment is necessary for these kind of patients. While varicose veins are large veins, they are more than 3 mm in diameter, and therefore if these are not treated properly, then the patient has, it's something like a hypertension. Any kind of blood pressure which is more, the person has to take treatment. Same way in these veins, the pressure in these veins become more, and therefore it damages the skin in the lower limb, and patients develop ulcers and a lot of problems. Anybody can suffer from varicose vein, but usually it is patients who have been standing for a long time, who are sitting for a long time, who are not doing exercise. Females are more common for varicose veins. So these are, and another last is patients who are obese, who are fat, they develop more chances of varicose veins. But as I told you, anybody can develop varicose veins between the age of 10 and 80. Varicose veins, as I have told you before, they form mostly in the lower limbs or the legs. There are very few people who have varicose veins anywhere else in the body, but mostly they are formed only in the lower limbs. See, as I told you, varicose veins can be prevented by doing a lot of exercise, moving around, not sitting for a long time at one place, doing some leg exercises if you are sitting for a long time. This way you can prevent the progression of the disease of varicose veins. Initially the patient comes with pain. On prolonged standing, patient gets pain. That's the earliest symptom. Next symptom is swelling of the legs. By the evening they develop a lot of swelling in their lower limb. That's another symptom. Third symptom is itching. They start developing itching in the lower limb. And if these are early symptoms, if they are not taken care of, then the legs become dark, pigmented, ulceration. So a lot of ulcers then develop and which refuse to heal. Nowadays we treat these patients by varicose veins by either endovenous laser treatment, it's called EVLT, endovenous laser treatment, or there is something similar which is called as RFA, that's called as radio frequency ablation. So these are very small, minimal invasive techniques. Like patients wants to go home, so in this kind of procedure also patient goes home the same day, patient does not have to take rest, and the pain is very less, and there are no scars or disfigurement on the legs. So we believe in healthy legs. See, approximately it costs around 80,000 to 1 lakh per leg. So it depends on what problems the patient has. Multiple procedures are needed in that. So the treatment varies between 80,000 to 1 lakh. Yes. Certainly, once treatment is done, varicose veins disappear. Very occasionally, the varicose veins can recur if they don't do follow-up. So I advise all my patients to come for follow-up for a long-term basis, at least 2 years. If they come for 2 years follow-up, most of the time we see to it that recurrence rates are very less. Obviously, any treatment with any pathy, there's always some chance of recurrence is there, but most of the time it's not that almost all patients are going to develop recurrence. Recurrence is very less if done properly. Best possible result is obviously to get it done from the right doctor at the right place at the right time. That's very important. You come early, we can give you good results. So right time is also important. There's no particular age. I would say whenever these kind of patients develop symptoms, they need to get evaluated. You know, there is a very special test which one needs to do, that's called as Doppler venous testing. And the most important thing about testing is if you do in the wrong position, reports are unreliable. So I always advise doctors and patients to do this test in standing position, and if there is chances of varicose veins, they need to be treated as early as possible, as I told you, to get excellent results. See, treatment, anything in life has some amount of risk. I don't say there are no risk at all. Anything in life has risk. Same way, taking treatment for varicose vein also, there are some negligible risk, but this risk are very less. The treatment outweighs the risk for varicose vein treatment. So I would say risks are very negligible compared to the complications which can occur if you don't treat properly. Side effects, if done properly, it has to be done under sonography guidance. If it is done under sonography guidance, I don't think there are any side effects. They should wear stockings, special stockings which are called as graduated elastic stockings. You know, there are multiple products which are available in the market which are not of the right type. What you require to wear is graduated elastic compression stockings. I am not aware of any ingredients, home remedies which can help. Of course, there are advertisements which, if you go on Google, there are a lot of advertisements like this, but personally and my firm opinion, they don't help at all. Even the stockings, they will not control, they will only control your problem. They never cure your problem. If you want cure, then the only solution is to get right treatment. See, as I told you, most important is not to gain weight. That's the most important thing. Stop smoking. These are factors which increase other kind of diseases. Keep your diabetes under control. That's what I would advise you, any patient, to be very strict and rigid and take care of their good health which God has given free. Find, connect, follow me on Medicalwale.com. आपके हेल्थ का साथी. Thank you.